So welcome to the first ever Ms.Medicare 2021. I think you guys know who I am, but I'm going to introduce myself. My name's Amanda Brewton, and I am the owner. I am the owner of Medicare Answers Now. Thank you. Thank you all for coming. Thank you for your support. We did it. We hit 500 people that registered for this free event. 44 states are here, in whether they are televised or through Zoom or whether they're in this room. We have 23 states present in this room, so thank all of you for going ahead and traveling. I really appreciate that. I know that there's some cost and some expense there, but unlike other seminars and different things that you have, those that have been working with me for years know that I am a big proponent of doing free events and giving that knowledge out to go ahead and make you guys better. And 120 days. 120 days, and look at what we did. Can you believe that? Look at what we did. Not only that, so rather than 2 ticket sales, we did a donation drive for Dress for Success, who you guys will be hearing from a little bit later. And with them, so far, we've raised a little over $2,800. So thank you for your donations to that. You can also drop them there or mail them in as well. So thank you. Couple of things, just to go ahead and if we can do there we go. So some housekeeping. Pictures are encouraged. I know you guys like selfies. I know you like pictures, so come on, whip them out, do your phones. I'm all about it. Definitely. But please, do me a favor, put the hashtag Ms.Medicare 2021. And yes, the inference is that we will be doing one for 2022. This was a little popular, just a little popular. So with that, thank you. Other things that for Zoom attendees that we have, thank you for attending through distance. I know with COVID, some of you were uncomfortable with traveling, as well as you just couldn't make it, or it was sold out. I mean, this event, guys, sold out in 6 days. Who does that? Me. That would be me. And Scott Handlon goes ahead and he goes, "How did you do that?" My big mouth. Everybody knows I don't need this mic. Come on, right? So anyways, for those that are Zoom, this is going to be interactive. For those of you that have never been in front of me before, welcome. I hate formal presentations, so I really encourage you to ask questions. This time is yours. The day is yours. I want to be able to celebrate you. I want to be able to celebrate us and learn from each other. The whole goal and the whole point of going ahead and having this on a Monday so that you guys could fly in and travel on a Sunday was so that you could meet each other. How many have met somebody that they've never met before here? There we go, mission accomplished. How many of you spent yesterday evening with Galen? Oh yeah, she is unbelievable, isn't she? So, couple of housekeeping things that I do need to just set, just because most of you have not been in a room that I've done. I want a safe environment for everybody. Those of you who have listened to me before know my rules, but the new ones do not. So there is absolutely, under no circumstances, any kind of recruiting here. I want to make it a safe environment so that there is a free exchange of ideas and conversation where you don't have to worry about somebody preying upon you, okay? If that happens, I will tell you right now, I view it as a sign of disrespect. I will bounce you out of my events permanently. There is no, "Oh, I'm sorry, I didn't know." Hear it now, hear it loud. On a better note, questions, as I said, are encouraged. Those of you on Zoom, type it in the chat box, and then we will be reading those real time, so that way you're good to go when it comes to that. Okay, so all of you have folders and all sorts of goodies. Did everybody get a gift bag from Kevin and a name tag? Did you look in them? Did you like them? Yes. So in your folders, you have an agenda with all sorts of paperwork. You have biographies of all of the speakers today, so you have a little bit to know what to expect going forward. I am going to hand this off to Scott Handlon from Oak Street in a minute, who was gracious enough to be my first sponsor and say, hey, I believe in this idea, and I'm going to give you a hard time because of it, but you have no idea of how big this is going to get. So thank you for believing in me. You always do, and I love you for it. So we will, yeah. Who just said something? Yes, thank you. And these lights are hot. Whoa. Anyways, so in your folders, you have a little bit of different stuff. Also, the pad folios with the carriers, all of the carriers that are here today wanted to be involved in this magnificent event for all of you. And I asked them to give you business-focused giveaways or girly ones. So that's what you got, the compliments of Anthem, you got the pad folios, and then I think the pens are totally cool from AARP. So there's a little bit of stuff in there. And then the other thing that I want you to go ahead and take a look at, because some of you ladies wanted to go ahead and run away from home for a weekend next March. So call me crazy, but I said, sure, why not? I'll be Julie, the cruise director. I looked pretty good in the damn hat yesterday, so why not, right? So if you are interested, we are doing a Ms.Medicare cruise that leaves out of Miami and goes to Key West and the Bahamas. It's a 3-day thing, and the information is in your folder. So with that, I'm going to turn this over to Scott so that he can go ahead and start talking about Oak Street. I've had the pleasure of working with Scott for 4 years now with all of his locations across the country, and it's been fabulous. So there we go.
Thank you, Amanda. I'll start off by saying being one of the only guys here for the most part is kind of intimidating. So with that in mind, hold on a second. I want to take a moment to bash on men. So this little joke to break the ice. The Woman's Guide to Love and Lasting Relationships. Some of you may have heard this joke before, but I thought it was pretty funny. Number 1, find a man who makes you laugh. That's pretty important. Number 2, find a man who has a good job and can cook. Number 3, find a man who's honest. Is that hard? Number 4, find a man who will pamper you and give you gifts. That's pretty important. And number 5, find a man who is awesome in the bedroom. Hey, I didn't write this, okay? Lastly, most of all, it's very important that these 5 men never meet. So, I hope that wasn't too risque first thing in the morning. I'm Scott Handlon. I'm the Vice President for Managed Care Partnerships and Growth for Oak Street Health. In short, Oak Street Health is this phenomenon that's kind of happened over the last 8 years that is kind of taken the nation by storm. CMS, Medicare, is definitely in love with what we're doing. And we'll talk a little bit why throughout this presentation. But in a nutshell, we're trying to change healthcare the way it should be, and that's an enormous task. But we're not just trying to do it, out in the suburbs and the rural areas. We're trying to do it in neighborhoods where the sickest people live, the most vulnerable patients that you and I get to help. And so, to me, I'm pretty passionate about the mission because I've seen the results. I've seen before my very eyes when I go into new markets and I get to see the first time someone comes to us, and by the way, oftentimes it's an agent who sent them to us as their first appointment. When they walk in, they have their appointment, and they come out, and I get to say, "What'd you think?" It can be emotional. Sometimes, this happened at least 3 times to me now. One of them was in Cleveland, actually, when we opened just under 3 years ago. They just start crying. And that's kind of like, whoa. First time it happened to me, I was like, wow, what's going on here? And the words out of their mouth is, it's the first time it felt like a doctor listened to me. It's the first time I felt like a provider cared about me. That's pretty sad, but yet exciting to me at the same time. So ultimately, that's what we're all doing. We're trying to meet these folks where they're at. They don't understand Medicare. It's very confusing, right? So today I want you, we can jump to the next slide. I want you to understand that if nothing else, you need to have conversation deeper than just enrolling someone on a plan, especially in the neighborhoods we're going to talk about today, because they're far different. 83% of our population has 2 or more complex conditions. They're really sick. And then we won't even get into all the details about cultural competencies and looking at epidemiology and the fact that the minorities in our country in these locations we're talking about are not getting the same level of care that our minorities and others are getting out in the suburbs. It's far different. That's what I want you to understand today. So thanks for having us. Really appreciate it. This is kind of my background. We won't belabor that. I'm a pretty boring guy. I'm married with 4 children. My beautiful wife's here today helping us out. But I live in Indianapolis, or a suburb of Indianapolis in Avon, Indiana. Been with Oak Street just under 5 years. When I started, we had 12 centers, and now we're like 97 as of today. So we can jump to the next slide. Thanks for actually advancing those for me. It makes it easier. So as I said, today I want to introduce you to our mission, our care model, and talk about some of our clinical outcomes as kind of the first round on this agenda. So jumping to the next slide, let's start off with this video so it can give you a pretty good overview of what we're about.
Listening is the heart of what I do. It's what makes it enjoyable for me to be a provider. It builds our relationship. It lets us understand each other. But even more importantly, I cannot provide excellent medical care without listening. I love hearing about patients' past, about their present, and their future, their hopes and their dreams. And my job as a provider is to take all my skills and knowledge to improve their lives now and help them reach their hopes and dreams for the future.
Another way we listen is by coordinating your care. This means scheduling transportation to and from your appointments, connecting you with specialists, and many other services that allow us to better manage your health. Coordinating your care also means helping you understand Medicare. Patient relations managers can help you understand your insurance coverage and explore savings on Medicare and medication costs.
What I love most about being a PRM is being able to help the patients and make sure that they are getting all their benefits they deserve.
Plus, they can check if you're eligible to receive additional coverage for services like vision, dental, and gym memberships. Our patients are our best advocates.
We all want the same. We all want to be loved, and we all want to be happy. And when you get a chance to come to a place like this, and these wonderful individuals are demonstrating that type of a care.
We also offer services like behavioral health counseling, in-center pharmacies, daily activities in our community rooms, and more time spent with your doctor. Because they know how to listen to you.
With these,
And this.
with my mouth shut,
and my ears wide open.
it means that from the moment you walk into the room,
You're the most important patient to me.
Oak Street Health, doctors for adults on Medicare.
One of the stats I saw, I was just doing a little research this morning, and it said that almost 50% of all women have changed doctors in their lifetime because the doctor didn't listen to them. Would you guys agree with that? It's probably higher in our neighborhoods, to be honest. What's going on in the neighborhoods we serve, right? I want to talk about that before we get into this. The neighborhoods we serve in these 5 to 8 mile radius, radii or whatever, I'm going to get my grammar right one of these days, of Oak Street centers, these same people tell agents they love their doctor. I want to tell you that up front before we get to the details. One thing that's going on is they can't get a hold of the doctors. The doctor's offices that they're going to are seeing all walks of life. So pretty much all age groups, maybe minus some pediatrics. They're overwhelmed. Those practices are overwhelmed because the places we put our centers, there's a scarcity of primary care. It starts with that, okay? So they can't, when they do go to their doctors, these doctors may have 2,500 to 4,000 patients, each one of them on their panels. That's a lot, okay? And so they can't get anybody to call them back. They can't get appointments. It may be 6, 8, 12 weeks down the road, right? The transportation, whether you've got them on a plan or not, if you in this room that sell to a lot of the lower income side in these urban neighborhoods understand what I'm saying when I tell you that transportation is not reliable. It doesn't show up. They have to pick up multiple people, which in COVID, that's a reason not to go to the doctor. Transportation's a big hurdle, okay? Second of all, when they finally get there, it's a room full of people. I've heard stories in New York City a couple of weeks ago where the patients, some of them pack lunches. They get up at 5 in the morning and they're packing food to go to the doctor's office for a 9 o'clock appointment. Now, why in the hell would you have to pack food for a 9 o'clock appointment, right? They're packing lunches because those places are double booked, they're overbooked. That appointment might not happen until 3 o'clock or 2 o'clock, and they sit in there all day waiting for that appointment. I'm not exaggerating here, folks. This is the stuff that's going on, okay? And they finally do get back to see that doctor, and guess what? How much time do you think they're getting? Right? If you're 75, 76 years old and you have 2 or more chronic conditions, it's a recipe for disaster. And that's why their lifespans in the neighborhoods we serve is 5 to 8 years less. They're getting 4 or 5 minutes. They can't talk about anything but one issue, and the doctor's kind of hanging on the doorknob. Okay? That's what's going on. They get out of there, and they've got to wait. Maybe they've got a page with 3 specialists that they've got to call themselves and set an appointment. Do you think that's going to happen? It doesn't. If we're not helping them, it doesn't happen. So they wait for the transportation. It could be another hour to get back home. All in all, they've spent 8 hours for a 4-minute appointment. That's the point I'm trying to make to you. These neighborhoods are different than you're seeing in the suburbs. If you haven't sold a lot of folks in our neighborhoods, you probably don't really believe me right now, but those that have, I think you probably do. So just looking at where we're at, I'm gonna get away from that negative stuff because there's a positive answer that's here, and that's Oak Street Health. Our vision is to provide measurably better health outcomes in all communities. We're right around 97 centers today. Just looking at hiring doctors right now, that's always part of our big fun as we're expanding as fast as we are. We'll probably be around 130 centers by the end of the year, just to give you an idea of the exponential growth we're experiencing. Wherever Oak Street goes, we grow well, okay? So we're always looking to recruit primary care doctors. Right now, we're actually around 120,000 patients. The amount of centers we're opening this year alone is adding another 150,000 patient capacity for us. So we're always taking new patients in any center, right? We can jump to the next slide. We do only see Medicare eligible, all right? Doesn't mean only 65 and above. There's, as you all know, there's a lot that are disabled and on Medicare as young as 20, 23 years old, which we have. So if you can't tell already how I feel about this, these pillars will tell you like what we're about. We believe in personal, equitable, and accountable health care. That's how we're rebuilding health care the way it should be. Amanda said to me a long time ago, she said, we're old school medicine in a new age way, and I think she's right. That's really what we're trying to do with a lot of technology. The guys that founded this company are really, really smart. They're all Harvard guys, JDs, MBAs, and an ER doctor from Harvard, and they're just incredible individuals. But they believed healthcare should be customized and personal. Even in the neighborhoods we serve, we want that. We want the red carpet concierge service that is personalized. They should feel warm. They should get their phone calls answered in the middle of the night with a live voice. They should get phone calls returned. That's what we're aiming for. Equitable, really, for me, that's the part why I'm at Oak Street. I've been at J&J and Eli Lilly and IU Health there in Indiana, really, really great companies. This is the best company I've ever worked for because the mission is so powerful. Together, we're making a huge difference. But equitable means it should not matter your race, your creed, or your economics. You deserve better. We all deserve better. I was going to ask you guys in the beginning to shout out if you could change anything about your primary care experience, what would it be? Because I believe even if you have affluence and you live in the suburbs, you're not getting what you should be getting. I'm not. I call my doctor right now. They're not going to answer the phone. I'm going to be on hold for 20 minutes, and no one returns my phone call. And if you have children, that's pretty aggravating, by the way. So equitable, this matters. This matters. Everybody deserves this, and especially those in these neighborhoods, they deserve it. Accountable means we hold ourselves accountable. If we're not delivering, if our patients aren't thriving, neither are we. Most of you don't have doctors who are 100% at risk for your health. We are. That's a really important point because it drives a lot of really good behaviors. It's things like the doctor's calling you himself or herself when you have not been into the doctor for 12 months and you have not had your annual wellness review. Accountable means he or she knows that if they don't do that, they're not going to meet their metrics and they're probably not going to get their incentives. Besides the fact that the folks we're hiring are doing it for the right reasons, you also need incentives. So, jumping to the next slide. What's different? The equitable care comes from an elevated primary care experience, right? We have to deliver. We can't just talk about it. We have to deliver. So, having right now with COVID last year coming on, we switched to 97% of our appointments almost overnight went to telehealth in these neighborhoods. I'm telling you, the clients in those neighborhoods that weren't coming to Oak Street were not getting that option, right? We had that for them, and we still have it. Some folks are still afraid to get out. 24 support line, what does that mean? Let's pretend that it's 3 in the morning, Christmas. A live person answers the phone when your clients call us. Every single time. And they triage the situation. Do we want them in an ER because they can't get a hold of somebody when they don't need to go there and be exposed to a lot of pathogens and a lot of frustration that they're sitting there for 7 or 8 hours? No, of course not. So having that is important to us because we're at risk. We invest in this. Rides to and from the center, we have our own vans. It's one-on-one, doorknob to doorknob. And they're really cool, wheelchair accessible. And the drivers are like, they're part of Oak Street, right? It's warm, it's friendly. Here's a bottle of water. They walk them from their door to the van. It's pretty cool. And we also have people full-time that are navigating Medicare for them. They're called patient relationship managers. We can talk a little bit more about that in a second. So that's actually an added benefit for you all. If you're selling a lot of folks in our neighborhood that are really sick, you're probably getting your phone blown up because they're not calling the 800 number on the back of the card. Preventative care plans to meet your health goals. Everything we do is about that. We invest tons and tons of dollars up front to prevent bad things from happening so that we're not hospitalized. So, and then...
So someone wants to know how, on the Zoom, how is someone eligible for the rides to the locations?
Everyone's eligible, as long as they're within the mileage. Let me back up. As long as they're within the mileage, and every center varies. New York City is more like a 2-mile radius, given the density. But around here, for instance, you're probably looking more like 10 miles. So that's kind of the variance depending on density and so forth. Yes, ma'am. MDs, DOs, nurse practitioners, yep. Yeah, the care team consists of, we'll jump into it. The care team consists of a MD or DO and a nurse practitioner. Then they have the nurse, the scribe who takes all their notes for them so that they don't have, we want them focused on the patient, eyeball to eyeball, and building trust. There's the RN, the MA, the social worker, the behavioral health specialist, the patient relationship manager, as well as our outreach directors, who usually are the first ones, their teams are the first ones to meet these folks in the community. So, great question. All right, so every center we have, we're trying to meet folks where they're at in terms of their language. So if it's a big Hispanic area, Spanish speaking, that's what we're trying to do with both, well, with providers, with the staffing and all that. So in New York, we're finding, hey, that's the melting pot of the world, right? I mean, we've got a lot of challenges to meet there because there's so many languages being spoken. So those are some of the big differences, feature benefit. We can jump to the next slide. The proof's in the pudding, guys. You're 2 times less likely. Again, did I tell you guys these neighborhoods are different and that they're really sick? You can reduce hospitalizations. If you're 2 times less likely to go to the hospital because we did all those things on the previous slide, it's pretty cool. The quality metrics that we're producing from that's amazing, and they're getting better. They're happy. They're delighted. They're 2 times less likely to be hospitalized. The big stat, if you understand Medicare and quality metrics and HEDIS scores and all that, readmission rates, the 30-day readmission rates, there's a lot of reasons why these really sick folks in these neighborhoods keep getting readmitted. Things are not being addressed at the hospital on their discharge. There's no one coordinating the care from the primary care side. There's no quarterback, okay? So huge data, we can jump. Net Promoter Score, that is a great stat that tells you that if your client's coming to us, they're going to be delighted. The what do you guys think the average, hopefully it's not up there. The average, first let me step back. Net Promoter Score is a -100 to a +100, and we're a 92. What do you think like Netflix and Amazon is? Anybody? It's in the 80, I think it's somewhere like 78 to 85. And so I like those brands. They've done well for me. We're at 92. The average primary care office across the country is a 3. I don't have the score for what our neighborhood primary care, those scarcity of primary care offices that are in our neighborhoods are. Let you do the math, okay? We reduce ER visits by 50. You're 2 times less likely to have to use an ER as well if you're coming to us. And our STAR scores, HEDIS scores, if we have patients, if you took all of our patients we've had 12 months and beyond, 5 stars. If you're a health care plan, that's a pretty cool number. That means you get to invest more next year in your plan. It makes it easier to sell for you guys. I think it's something like $8 million for every half point that you increase stars. Medicare in that market allows another $8 million in investment. That's the stat I've heard. Take it for what you will. Jump into the next slide. Ooh, almost out of, that would have been funny, Amanda. Yeah. So I just put this slide in here because I know I'm agnostic when it comes to health plans. I want what's best for our clients, our patients, and I know you all do too. But this has been an interesting phenomenon that came about last year with Humana. They understand value-based health care. They understand that our population and their population that we share are really sick and that they need better health care. And so they wanted to make sure that there was a way to measure in terms of the physician finder for agents when you go in there and you're looking for a doctor for someone who needs a doctor, which, by the way, about 30% of those in our neighborhoods do not really have a primary care doctor. You've got another 30% or more that are really unhappy, even when they tell you they love their doctor, by the way. So this is a way for Oak Street Health to rise above, to be the cream of the crop. We are the 4-star, our 4 badges, 4 hearts, with our doctors, somewhere between that 3.5 and 4 across all of our markets. That means when you're looking for a doctor for your client, we're probably going to be at the top. And they wanted to make sure, as a carrier, that they're getting more patients there. So jump into the next slide. This is just a good overview of where we're at. There's some things that are missing that have been publicly brought up here recently, such as Arizona's being added. St. Louis will be opening this fall, but that gives you an idea where we're at, and we can certainly, if you're from another state, we can send you an email with all the addresses for where you're at to see where you can plug your clients in. But that map's going to continue to expand. Okay, so if we're not where you're at today, you're in California, you're in Maryland. I think we're a couple probably coming your way at some point. I can't really talk about that a lot right now. So jump into the next slide. We're rebuilding healthcare as it should be. That risk model that I talked about, if you're fully at risk, you change things. and you do things the right way in places where it's really needed. So I think this is probably going to roll out. Go ahead and, yeah. The math on this is really easy, guys. The biggest cost to our healthcare system is hospitalizations, right? This is why we can spend a lot of money up front, because we're saving Medicare, we're saving the taxpayers, everybody, a lot of money in hospitalization costs by preventing them and making their health care get better and bringing quality of life back. Like the lady that I talked to who came to us, she had been coming to us for 3 months, and I was blessed to talk to her because she was like she found religion. She was so excited. And she said, I got to tell you, I couldn't walk upstairs. I could not walk upstairs the last 5 years. I come to Oak Street, the very first appointment, the doctor says I have congestive heart failure. They start treating me. She goes, you know what, Scott? I can walk upstairs again. It meant a lot to her. It's not so simple. I mean, these things matter. So that gives you a good bird's eye view from our CEO of why we're able to do what we're doing. So how do you plug in with us? We can jump. The 3 pillars, really, we provide, if you haven't been able to tell that, the quality of care we're providing is beyond anything even you and I are getting. We have 25 agents in Indiana alone who are Medicare eligible that are our patients. Just to give you an idea of when agents see what this is, it's better than what they're getting. They use it. But high quality of care, so your patients, your clients are happy and healthy. Your clients, retention and customer service, that essentially means you're not getting chargebacks, you're getting your renewals. Can't keep everybody, but agents that sell a lot of folks in our neighborhoods are losing 30, 40, 50% of their clients throughout the year. The telephonic agencies are making that worse. We're helping protect that for you by taking really good care of them and making sure your agent of record is captured so that if there is an issue, we can get them back to you. And then also there's ways to grow with us in terms of access to the community. If you're an agent that does a lot of outreach, you like doing food pantries, senior high-rises, and things of that nature, we want to talk to you because we can plug you in with our teams and you can go out and generate leads together and grow. That's one way we can help you grow. But the community outreach, we're really, really good at it. Each center, we probably meet somewhere between 400 and 600 new prospects every year. So we can jump because I know I'm going to run out of time. How much time do I have, Amanda? I'm up? Okay. So summarizing, winning together is what it's about. We do really, really well with agents and agencies. Amanda and I have been partnering for the 3 years we've been in Ohio, and she's been amazing, connecting us to the right folks and making sure that we can win together. So we'd love to get in contact with you. We have lots of marketing programs that we can help you besides the outreach side. We got a table at the back. Come and talk to us. So thank you, Amanda.
You're welcome. Thank you. So real quick, do not trip on there. So I want to just real quickly, before I let you guys break for a minute, why I like the facilities. If you have time, I know, Jesus, man, it's the middle of it's the start of AP. I don't have time to do anything. You want me to do what? Do me a favor. I promise, it's going to be worth your time. Take a tour. If you have not taken a tour of their facilities, how many of you guys have actually seen an Oak Street facility? Okay, half the room has not. Do me a favor. Take the half hour and go take a look at these facilities, because I will be the first person to tell this story real quick, and then I'll let you guys go because I've got some people dancing in their seats. Okay, what ends up happening is that Scott goes ahead and he starts in the market and he says, Amanda, really, you got to take a look at us. We're awesome. It's really good. We got to make this happen. Check us out. And I'm like, yeah, okay, whatever. You know, it's me, whatever, right? And then I ended up going to Indianapolis to do some regional sales training for Anthem. And he says, seriously, we have a fantastic facility here. I will personally take you through and do a tour. Take a look at this. Now, how many of you guys are from Ohio? Raise your hands. Okay, so those that have raised their hands have worked with me before. They can personally attest that I am the one that will tell you, if I like something, you know it. If I don't, you know it. So you got to give it to this guy that he had the balls to go ahead and say, hey, come check this out, knowing that, okay, I'm going to tell you whether I like it or not. Needless to say, I go into Indianapolis, we do the tour, and how I explain Oak Street when I am working with agents and saying, hey, this is an option for you when it comes to marketing. It's old school medicine in a new school way. And what I mean by that is that you have it where so many of the doctors that you go to, they don't know your name. They're asking you about medicines that you were taking when you were a teenager. I know mine does. So here it is where they have the ability in these facilities to have it where they know who you are. They have a low patient count to be able to have that relationship and look at the person in their entirety. That's what I mean by old school medicine. Think about it back in the 1950s and earlier than that, where you had the doctor with the medicine bag that is going and actually knew, and you grew up with that same doctor throughout your lifetime. That's that kind of model that we have going on here. So I encourage you, if you have the time, they are in multiple states. Harass Scott, he likes it, I promise, and go check it out. I really think that you guys will be pleasantly surprised with what they have and how their organization is. Okay, with that, we are going to take a 15-minute break. You are more than welcome to use the restroom, visit the tables, take pictures, not just of me, but of the group that you guys are with. Please be careful of these. They are going to fix them on the break, and then we are good to go. Joanna and Aaron, if you can go to the back to get Mike, that would be fantastic. So thank you, and I'll see you guys back in 15 minutes. Ladies, we're going to start back up. Hey, Nate, you said that, where is the clicker? Or am I throwing it again? Wouldn't be the first time. Whoosh. Awesome, thank you. Okay, last call, ladies, come on in. Let's go ahead and get started. Bless you. Linda, that bag is fabulous. Absolutely fabulous. I'm all about the glitz, it works for me. Okay, so my turn to talk for a minute. Okay, so because I have so many new people in the room, let me tell you a little bit about myself real quick, just so that way you have some history. Because you hear a lot about various different things about, oh, well, okay, who is she? Where the hell she come from? What's going on here, right? So I've been in the business for 16 years. Started with Aetna. God, back in the day, I went ahead and they were entering the Cleveland market with their Med Advantage and their PDP plans for Northeast Ohio, and I built their broker distribution channel. This was back in 2007 or so, somewhere in there, and excelled at that. And then eventually I got a phone call and they say, hey, guess what? We're gonna go ahead and have you teach, or we're gonna have you go ahead and be responsible for Medicare as well as under 65 in the entire state of Ohio. Then it was, well, guess what? We're gonna have you do Ohio and Kentucky too. Okay. So then from there, back then, pre-ACA, AARP had a product that was specifically designed for those that were 50 to 64. And what I did is I worked with a woman named Shannon Carmona who led that particular product. And Shannon said, hey, I'm looking at going ahead and building a national team to launch this product. Are you interested? And I went, sure, why not? So I decided, okay, let's get on a jet plane for a little bit and travel for the next 3 years. And I built the broker distribution channel for the AARP under 65 product with Aetna for 18 states. I had Illinois down to Mississippi and everything to the East Coast, plus Texas and Colorado, which gave me a lot of experience and everything else. So then after that, ACA, of course, appeared, and the chairman of AARP testified before Congress and said, well, if you bring out an ACA product, Obamacare, then there's no need for this product that we currently have. And he did this before Congress. So needless to say, ACA was passed, the product was killed, and I took some time off, did some soul searching, tried to figure out whether I wanted to be an independent agent at that time or whether I wanted to stay a carrier rep. And then I went to Anthem. So from 2013 to 2019, I was the regional sales manager for Anthem for the entire state of Ohio at one point. And then slowly we added additional staff over the years to get it to where they have it now, where they now have 6 RSMs in the state. With that, I'm very proud to say that managed the largest Medicare market in the country for Anthem for 6 years. So thank all of you that are from Ohio for helping me with that. Won a few awards, walked a few stages on that. But one of the cool things with working with Anthem is that my management, which was Laura Beth and Rob Cleary, gave me the flexibility to let my freak flag fly. And with that, how I started teaching was on a gamble, actually. Back then, they had said, you only have $5,000. That's it, $5,000 to split between 2,200 agents back then through the entire lock-in period. Can you imagine that? Or you can go ahead and you can do training classes. And what I chose to, but you can't have both. And oh, by the way, if you do these training classes, you will fail. How many of you guys have ever heard somebody tell you, you're a failure, just a girl, there's no way, your ideas are out of this, there's no way this is gonna happen, right? Same thing happened to me. They said, the only people that are gonna listen to you want to train are those that don't sell anything, and they're just there for the donuts. My Ohio crew knows, do I serve donuts, ladies? Ever? Hell no. So with that, what ends up happening is that we test it. 4 months, 4 topics, 4 cities. And magically, it starts building. So by the time that I get done with this risk, I mean, and it's a pretty massive one, right? Because you're coming into AEP, big company, everybody's questioning. I'm even doubting myself and going, God, did I make the right decision here? I got a lot riding on this. Well, I'm what you kind of know as an overachiever just a little, and I got a little bit of a big mouth. Just a little bit of a big mouth, right? So what ended up happening is that I ended up doing 7 cities, 7 topics over 6 months, plus the actual product rollout. So I ended up doing 62 in-person trainings all over the state of Ohio in a 6-month period of time. And that's how I started. And I started then going ahead and building my curriculum. So management came to me and said, wait a minute, you're gonna do these trainings, but we can't see that there's a direct correlation to what you're doing and the sales. Know what I did next? Hold my drink, watch this. Oh, and I did. We ended up going 140% to goal. Now, to give you an idea of what that means, that's approximately 13,000 brand new to Medicare applications in a 53-day period of time. Okay. So as I've been doing this, and as I have been encouraging agents to tell me, and I truly mean this from the bottom of my heart, the only way that I get better is for you to give me the feedback, the good, the bad, and the ugly, and I don't get offended by it. Tell me what you like about this event. Tell me what you don't. What can I do better? What content can I spin to get you what you need? Most of my Ohio crew knows I can design a class on the fly like that about damn near anything, and do. So with that, that gives you a little bit of history about me and how it is that I came to be. I ended up getting sick a couple of years ago, and my doctor said, you need to slow down a little bit. So I left Anthem. And they said, please don't go. And I took a little bit of time off, and then Craig Vilbach from TLC, who I think is in the back corner, or the back of the room. So thank you, Craig. He believed in me and said, come on, kid, let's go, let's do this. And, well, he says, tell you what, 2 years, 100 agents, and then you can own your own agency. And I went, I'll give you 2. So July 10th of last year, he went ahead and he says, come on in, we got to do a pre-AEP meeting. I want to talk to you about strategy and everything else. I come walking in. He goes ahead and he says, got a pen? Yeah. Have a seat. Hands me a ream of paper, puts them on the table, and he goes, your agency's going live right now. Right now. You better start making some phone calls and get to signing. Let's go. So that was a year ago. I was still hell-bent on going ahead and getting the 200 within my 2 years. My anniversary was this past Saturday, July 10th. 225. Now of that, and through my Anthem career, I ran the reports of the top 25 agents in the country, my last AEP, to see who fell where, because I'm a little competitive, just a touch. And what ended up happening is that of those top 25, 9 of them are mine. Of those 9, I got 4 in this room. So to the 4, you know who you are. Thank you for everything that you have done, for being a part of this. I love you. I love that you are women that are doing this, and to watch you grow, because I have watched you grow my entire career, or your entire career. That is the thing that motivates me. It's not the money. I'm not all about the Benjamins. I'm not all about, ooh, let's go ahead and let's posture. You will rarely hear me talk about my sales background. The only reason why I'm sharing that to you today is so that you can see it's possible. Because if somebody doesn't show you or share the good, the bad, the ugly, I was terrified to go ahead and start all over again. How many have felt like that? How many have questioned, did you make the right decision? I must have questioned that a half a dozen times, if once. And I'll tell you what, I wouldn't trade it for anything. There is nothing better to me than going ahead and having somebody that I've worked with for a couple of years that came to me going, I don't have a pot to piss in, I don't have any money, I can't do any marketing, I have no idea, but I know I need to do this and I need to make a change. Sound familiar? And then you go ahead and you look at them and go, okay, listen to me, we got this. It's all right. Follow me, and I teach the rule of 3 when I'm working with somebody. So with that, they would do the steps, they would do it and keep going and keep going and keep going. And the next thing you knew, 3 years later, with tears in their eyes, I have one of them. She was number 9 in the state out of 1,400 agents. And she looks at me and she goes, 3 years. Oh my God, we did it. Now I got to pick up additional agents. I got to pick up staff. I need to figure this out. Thank you for believing in me. That is what motivates me more than anything that I do. And that is where, and Sasha, I'm going to call you out, and I'm going to call out Michelle, who's in the back of the room, hiding back there. As she hides her face. Those 2 ladies, Michelle did it last August and said, hey, I am a new agency owner. I need to connect with other people that you go ahead and that do what we do. Michelle, did I fit the bill, honey? Can you connect with these in the room? They share their whole environment. That is Michelle. And then, so February, Sasha goes ahead and messages me and says, hey, we need to put together a women's conference. Can you do this? You got to do this. And I'm like, I am too busy. There is no way in hell. Within 72 hours, we go ahead and we put this together, and it boom, 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 boom. Thank you. Your ideas helped us with that, so I appreciate it. And then, yes, I am going to call you out, lady. Ms. Kim Moore, please stand up. She is the one that created our logo. So thank you for that. Okay, so now let's go ahead and start rolling into the material. How much time do I have? 30 minutes? Okay, let's go ahead and let's talk fast. Take your notes, whip out your notepads. Okay, so we're going to talk about business planning and goal setting. There we go. So one of the things that I found with agents, and that's a disconnect, is that, and you see it all the time on the chat, on the Facebook groups and things like that. Most of you know I'm heavy into LinkedIn. I'm also heavy into Facebook. We have a Ms.Medicare group. Join it, friend me, the whole 9 yards. With those groups, you see time and time and time again where people are going, I need to grow my business, but I have no idea of how to do it. Do you have a plan? No. How can you get to where you want to be if you do not have a plan? And one of the number one things that I see with agents that get into this business, and even my more senior people, is that you have got to figure out, what do you want to be when you grow up? What does that look like? Is it that you are going ahead and you are the stay-at-home mom with a baby that's not even a year old, that's just trying to go ahead and just create a life? Or are you somebody who's working part-time to get away from your husband that's making you completely batshit crazy, and you need to go ahead and just do it for fun, right? So you're like, oh, thank God, yes. So everybody has their own way of doing this, and you've got to have a plan to figure it out, because if you cannot measure yourself, you don't know what to celebrate, right? And it's hard enough as an independent business owner to go ahead and try to stay the course when you're looking at everybody else going, well, she just went ahead and bragged about putting up 500 policies on her first AEP. Now, y'all know that's a crack, right? Thank you. But you've got my new kids in here that are first year in, that are looking at that, reading that don't know any better, that I'm telling you, stop it. Find a mentor. Find somebody that you can talk to. Ask your questions. You cannot be quiet. If you ask your questions, you'll get the help, you'll get the mentoring and the stuff that you need. When you are looking at business plans, and because you are an independent business owner, you have to build your team. What do I mean by that? That is not employees, guys, at all. What this is you have to have people around you that'll tell you, Amanda, you talk too much with your hands. Slow down how you talk. You need to go ahead and stop using the 9,000 acronyms because the new kids have no idea what the hell you're talking about. You have to find people that will be able to go ahead and share your strengths or your weaknesses. And I'm going to pick on myself because if I call agents out, that'll get uncomfortable. But another one. Time management. How many struggle with time management? You procrastinate. You have issues. Those are things that you need to have somebody that says, you know what? You need to work on this next month. You need to prioritize a little bit better. They are the ones that will get you better. And it doesn't have to be somebody that you either work for or that you employ. Find a friend that will do that, or a confidant, a mentor. That's how you have to start with your quote-unquote tribe of your own. The next one is that you need to go ahead and figure out what your upline looks like. Okay, and we'll go ahead and we'll talk about that in a minute. But professional development is key. So normally, with my downline, I develop their business plans and their marketing plans with them once they're contracted. we go ahead and after that's all done, we sit down and I ask them flat out, what do you want to be when you grow up? What are your goals? What are you trying to hit ultimately in a year, in 3? What's your ultimate goal? What's your dream goal? My Ohio crew knows. I achieved my corporate goal. I'm not proving numbers anymore. You know what I'm proving? What I'm out to go get? Anybody want to tell them? I want the house in Tuscany. I don't want a house here. I want one in Tuscany. And yes, all of my agents can go ahead and come visit me. But that's a stretch goal that, damn it, I'm going to hit it. May take me 15 years again to go ahead and hit it. But that's what I'm going after. And nothing's off the table when it comes to those things. But you have to identify it. Once you identify what those goals are, then you back into it. So I'll give you another one that's more realistic. Let's say you want to go ahead and you want to come to the Ms.Medicare 2021 or 2022, and you live out of state, and you know that it's going to cost you with airfare and a hotel and everything else about $1,000. Divide that by 12. You have a year to plan for it, right? Now break that out. Now that piece of the puzzle becomes much more manageable than anything else. Let's spin it. Let's talk about Med Advantage plans. I'm going to use the national average here, guys, and round numbers just for easy math, okay? You want to make $100,000. Anybody know how many policies you have to sell a week to make 100 grand? Anybody? 2. That's it. 2. That's your goal. Can you think you can go ahead and put up 2 turning 65s a week? You can work towards it. Or you're hitting it and going, well, man, I go ahead and put 4, 5, 6 up a week. And that's easy. You got to build that up, but you got to break down those goals because the $100,000 seems like it's going to be huge, right? There's no way I can hit that. Can if I break it down into what the weekly activity is. If you do the right things at the right time and you're going ahead and you're prioritizing, it becomes much easier and much more manageable. Mel, did you have a question? Nope, you're good? Okay. Next one, and as you've noticed, I'm not reading these slides. I figure y'all can read as I'm going ahead and I'm talking, so just as a heads up. Feel free to take pictures of the slides if you want. So the next one, as I said, you want to go ahead and look at picking what your team is. You want to be able to figure that out. I have a lot of new kids, which actually, let me ask, how many of you guys are in your first year selling? Raise your hands. Welcome, welcome. How many are less than 3? Less than 5? 10 years in? 15. Okay, so, so with that, I want to break down the different relationships that you have, and I want to level set real quick. So when you get contracted, and I'm speaking specifically for Medicare, Medicare contracts are always different and separate than your individual and your group contracts. That means that you can run them completely differently and have 2 different uplines based on those products. You also own your business. Because you own your business, do not let anyone tell you, I want it all or I'm not working with you. You have that control, not them. You can put yours with a couple of FMOs or a couple of uplines if you choose. That's all your choice. The only way that that is different is if you are what's referred to as LOA, which stands for Licensed Only Agent. When you are an LOA agent, typically you have somebody that has called you and said, come over to me, I'm going to give you free leads, I'm going to advance your commissions, I'm going to give you co-op money, I'm going to give you training, I'm going to give you benefits. The trick to knowing whether or not you are an LOA agent or not is if the agency is paying you and you are not getting paid directly from your carriers, odds are you are an LOA agent. What else does that mean, ladies? Business isn't yours. So you're selling for somebody else. You're not an employee of theirs, but they own your block. Some people, that's a good fit, and I'm not knocking it. But I am trying to educate you of the different choices and the different options that are out there so that you can make an educated decision of what is best for you in your environment and for your family. Because that is above all everything that we've got, right? So you have LOA, and then you have an independent agent. Typically, an independent agent, you are going to eat what you catch, meaning that you don't get paid until you start selling something. You're on your own dime. Now, the trade-off of that is that you own your own business. It's yours. You don't have to worry about anything, which is great. But it's also super scary when you start out because that has to slowly build as you're doing it. When we look at how that works, let's talk about the alphabet soup. Every Tom, Dick, and Harry right now is calling themselves an FMO, right? Everybody. I just got into the business. I'm like not even a year old and I'm an FMO. No, they're not. I promise you they're not. So what do these mean? What does this look like? You have a couple of different layers with an upline, okay? And I'm going to explain the responsibilities of each one of them so that you understand how that works. A GA, otherwise known as a general agency. Typically, and these are generalities that I'm giving you guys, they are not, you're going to have some variances here, so I'm sure somebody will raise their hand and go, but I know of a GA that has only one or two. Okay, generally, a GA is somebody local. They typically they start getting overrides when they have 5 agents or more. They are responsible for the day-to-day stuff. So if you are looking for somebody to do ride-alongs with you, to actually sit down with you and handhold you day-to-day to go ahead and help you get into this business, usually you want to work with some local agency that is a GA, that is smaller in nature, that has the time to do that. And what happens is that they are paid what is referred to as an override to go ahead and give that service. The more that you sell, the more that they make. In addition to that, they can work with the carriers to go ahead and get additional money for marketing and so on. The next level up from that is an MGA, Managing General Agency. This one is relatively statewide or a couple of states, a little bit bigger in nature. Some of them do the day-to-day stuff, but not nearly as close to the ground as the other ones do. And with those, they're getting a higher piece of the pie. They will have GAs underneath them, but they're going to do more of the higher level training. They're going to offer some of those larger marketing contests that you see that are out there. The next level from there is what everybody and their brother is calling themselves, an FMO, NMO, IMO. They all stand for this same thing. Field marketing organization, national marketing organization, or insurance marketing organization. This is the grand poobah. Flintstones reference, gotta love them, and yes, I did take my Flintstones this morning, did you? So they are the grand poobah of contracts. What these are is they are an exclusive group that the carriers have gone ahead, they're relatively larger agencies. I can tell you flat out that Galen and Senior Security Benefits is a very well-respected FMO all across the country. TLC is. With that, the carriers typically have between 5 to 50 of these top-line contracts that are out there. And They are, what the FMO does is they use this money to, one, contract the MGAs and the GAs underneath them to help with that day-to-day business. But then they also go ahead and they are responsible for those large bells and whistles that you all have. How many of you guys have a quoting or electronic or online quoting system that you guys use? Damn near all of you, right? And it's free for you to use. Okay? When you are going ahead, and some of you have said, well, my FMO doesn't do anything for you. Do you have any idea of how expensive that system is for them to go ahead and run and to be able to offer to you? It's well over $100,000. And it's the bigger that they are and the more apps that they do, the more that they have to pay to be able to use that. And it's a convenience thing for you guys rather than Medicare.gov, right? But those are the high-level things that they offer. How many of you that your FMOs offer you a trip? Raise your hands. That you can qualify for a trip. That's what the FMOs do. They'll go ahead and they'll do trips for ancillary products like dental, vision, hearing products, or hospital indemnity, or med sups, things like that. The more that you sell, then you've got a trip to Rome or Costa Rica or wherever that is that they're looking at doing. That's what an FMO goes ahead and does in their day-to-day. That FMO is not responsible for that ride-along that you want to do on Friday. Normally, they will not do that. It's very rare that you will find one. So if somebody is calling themselves an FMO and they're saying, hey, but I do ride-alongs daily, there's maybe 3 that I know of that do that, do some digging, ask around. Before you do your contracts, you want to do some research. You want to interview them. If you want a sample of an interview of an FMO, look at the bio that I have, flip that page around, and you will see the FAQs. I've posted that in social media several times. But it gives you the starting point. They work for you. You do not work for them. Let me say it for those in the back of the class. They work for you. You do not work for them. When you are looking at doing your contracting, you want to interview at least 3 to 5 before you settle on a home or homes so that way you can figure out what is best for you. When you go ahead and you do that, Anne, where are you? Over here. Happy birthday to you. Happy birthday to you. Happy birthday, dear Anne. Birthday to you. Thanks, Jim. Love you. And I work with my husband, so. And he's still alive. Go figure. They've been married for years. Happily, too. That was awesome. Anne is a dear friend of mine, and that I was fortunate for her to choose to spend her birthday here. She drove well over an hour to come. So, okay, big deep breath. Anyways, so your FMO works for you. You want to go ahead and do the interview. You want to figure out what's a best fit. And it may be that a couple of these FMOs are a better fit than throwing everything all together. So the next question that I get asked is Amanda, why would you split them versus going ahead and having them all with one? If you put them well with one, you have one place to go ahead and do your quoting and your enrollment. You have one place to go to say, hey, I got a problem. You don't have to remember who's with what and have to deal with any of that service stuff that we all hate doing. Everybody in the room is far more productive when you are doing sales versus service, right? So having that one point of contact makes sense to do. Also allows you to have more power, if you will, when you're talking about your numbers. I need $5,000 worth of marketing. If you have all of your carriers with somebody, with an organization, they can see what you've been able to do. They can see your track record. Because they can see it in its entirety, they can say, you want $5,000. Are you smoking something and can I have it? You only put up 100 apps in the last 2 years, and you want $5,000? What, are you crazy? Or they can look at it and go, well, you nailed that AEP and put up a couple hundred apps. Sure, without a problem. Anything you want, we got it, right? So that's where the positive comes from, going ahead and having it all in one central location. Now, if you have it split up, you may have it where you like that one FMO is really good with social media and another one is really good with their tools. Or one offers a better trip and marketing money. You have to figure what that looks like. And then that becomes, when you make those decisions, that's the next part. Now, because it's that time of year, we are in research season, right? Everybody knows. Game on. Who's taking the AHIP for 2022? Yeah. Okay. My advice, get that out of the way the month of July. You'll thank me later. The sooner that you do it, the easier that AEP becomes, and then the less stressed that you are when we're doing this. I know you want to be with your kids. I know you want to be out in the pool. I get it. But you do it an hour a day. But knock it out and knock all of your certs out by July, by the end of July. The reason why that is that allows you to pre-order your kits so that you're not in a panic come 10/1 going, where are my kits? Where are my kits? Oh my God. How many of you been in that situation where you're going, I need kits and I don't have them? Knock that out of the way and then you have it. Time management is the key. Everybody wants to know what makes somebody successful in this business. Time management and a business plan are the two biggest keys. Two biggest keys. And then finding the right partners that work for you, that motivate you, that engage you. That's where that is, okay? So the last piece about the contracting. Now is the time to look at your portfolio. You want to look at while the early looks are starting to come out. Look to see if you have the right portfolio mix of MedSup, MedAdvantage, PDP, and everything else. Cigna's PDP is non-commissionable. Elixir's PDP is non-commissionable, for those of you that do not know that. So Cigna Health Springs may be in there, and it may show up on Medicare.gov. That does not mean that you can sell it and get money off of it. You can't. When you're look at the new products that are coming into the market. So, Lori, you've got Devoted coming into your market. Those in Florida, Devoted's coming into many markets there. Centene has got some expansion. United has some expansion. Humana has some expansion. Find those things out and then figure out if that's what, you need to add those into your portfolio mix. The last piece of this is that any licensing change that you need to do, whether it's a change in your hierarchy or going ahead and adding new products in. The licensing departments within the carriers are drinking from a fire hose right now because everybody is trying to get contracted and enter the market because y'all know how this goes. Oh, I just got my license January 10th, and I'm going to come in this AEP, and I'm going to sell 150 policies, and they have no plan. So you have all of these people coming into the licensing which floods it, which means that it's going to take 2 to 3 times longer to get those shifts processed, and you all want that done by September. So the sooner that you get that out of the way, great. Let's talk about releases. Releases must be in writing. They've got to be in writing, guys. What a release is that if you have an FMO, if you have an upline, regardless of who it is, and you say, you know what, I want to move somewhere, wherever that may be, even if it is that you want to go direct, you need to get a release in writing from them for every single carrier that you are looking at moving. There are some FMOs that will refuse to give you a release outright. There are other ones that say, it's after July 1, we're not going to honor it until January, and you're stuck like Chuck. Okay? Know that. That is a common practice within the industry. I am saying this so that way you are aware of the different practices that are out there, good, bad, and ugly, so that you have the education to be able to build your businesses appropriately, okay? You have to do it in writing. You cannot do it with a phone call. And if they say that they are not going to give you a release, that email is your clock. Whether it be a 90-day clock or a 6-month clock for you to be able to move your contracts after X period of time is up. Anybody have questions regarding this before I move? We good? Certified letter, no, but it does need to be on letterhead. Aetna has their own form that must be used. Mutual of Omaha has their own form that must be used. The other ones, the email and the letterhead work. Other questions? Nope. So the question was, before you sign up with an FMO, can you get an upfront release? And the answer is no. So my way around that is that I put it in writing. If you look at the FAQ that I gave you, I flat out said, I don't want to work with you. You don't want to work with me? See ya, I'm out. I'll give you your release regardless of when it is, on to the next. There's no hard feelings, there's no nothing. That's where I'm at. I want to spend my time with those that want to spend their time with me. I'm not going to hold it for some stupid reason. That's just me. There are others that do the same. There's actually several that do. And then there are and they will put that in writing in that context, but they won't give you something to say, hey, use this as a get out of jail free card whenever. The next thing that you need to know is that any shift in hierarchy that you're looking at doing, those blackouts for the carriers start August 1. If your changes are not done by August 1 for the majority of carriers, what ends up happening is you now have to wait until the middle of January to process all the licensing changes.
Amanda, we have a question online.
Yep.
Is it always 90 days or 6 months, or could it be longer before you get released?
It depends. I know Humana, depending on who you are contracted through Humana, there are some that can be a year. If you have an outstanding balance with a carrier, that you have done an advance on commission, which I do not recommend that you guys do in any way, shape, or form. What ends up happening is that if you owe large sums of money, at the end of the day, the FMO is on the hook for the money that you got paid. And some of these carriers do a 12-month advance. That's where we end up going ahead and having it. So you really want to go ahead and watch with that. Any other questions? Yeah, Francie. I am actually, some of my contracts are FMO level, and then the majority of them are MGA. So I'm kind of riding that line. Does not matter to you in any way, shape, or form, because what ends up happening so Francie's question is does it matter when working with me if I'm an FMO or an MGA, for example? Does it matter, and does that have an effect directly to you as an agent on the day-to-day? And the answer is no. It matters to me because it matters as to the amount of money that I get paid to motivate you to sell, but that's really all that does. So it just shows the strength that I have within given carriers as to what that looks like.
Will a copy of the packet be given to those physically attending and emailed to those online?
I will clear it to see if the other speakers will. On my slide deck, yes, I will go ahead and send that to everybody that's attending.
What happens if you invested time into an agent along with money and they ask for a release after 2 months?
For me personally, see ya. Bye. Door's always open. There's no hard feelings. Knock yourself out. Candidly, and I know we all struggle with this as women, but I have learned my worth. And again, I want to work with those that want to work with me. I don't want somebody that I'm holding hostage. Other people feel another way. Now, have I been burned by that? Yeah. And very quickly, because I think I'm almost at time. I'll tell you a story. 2. I had 2 agents in the last 2 years that left me. One, he's been with me for 2 years. I've given him free leads. Good ones, turning 65, way out, first hit, turning 65 leads. They're not reused, they're not nothing. I've given him retail opportunities. I've given him AEP marketing opportunities. I've offered him co-op. He hasn't sold anything, and every time that I call him to go ahead and say, hey, I have this opportunity for you, he goes, yeah, I really don't feel like it. And then he calls and he says, I didn't sell anything. And I've been doing this for 2 years, and I don't know what the problem is. Legit. The email said, I don't know what the problem is. I have not sold anything. And Mary's sitting here going, yeah. So he goes ahead and he says this to me, and I'm like, okay, so-and-so. I said, can you tell me what I could have done better? I said, I offer bi-weekly training, bi-weekly team calls. You've never been on a call. You've never attended any in-person training that we've done. You've never attended any carrier training that we've done. You have never taken advantage of anything that we have done in 2 years. And most of you that know me know I vary the day, the time, everything, and I offer classes a minimum of 6 times per topic. And that's where so you can't justify it. So I responded back and said, well, what? And he goes, oh no, the onus is on me. You didn't do anything wrong, but it's not my thing. Okay, fine. The other one, brand new agent, I was totally excited about working with her. Game on, hot and heavy, first couple of months. Went ahead, I did a lead mailer for her. 49 leads came back for that 1,000-piece mailer that I did for her. 49. Thank you, Chris, from Lead Concepts. It was his. So listen to that man. He knows, he will guide you. So anyways, 49 leads. She never called them once. Mel's like, can I get him? Yeah, come on, baby, let's go. So that ends up going ahead and happening. She didn't call him. Now here's the thing. So some of you are going to go ahead and look and go, okay, well, she didn't know that they were there. It's transferred electronically. I didn't know that they were there. Okay, again, it goes back to I got a loud mouth, right? You think I didn't go ahead and get loud with that? Where you at with these? They've been sitting for a week. Did you call them? Did you text them? This is what's going on. Here's the best practice on how to go ahead and reach out to these people. Here's how you can go ahead and do this. Her response when I asked her, you're going to love this one, I didn't feel like it. I was on vacation. Kid you not. I can't make this shit up if I tried. Then she goes ahead and she text messages me because I message her and I'm like, you all right? I haven't heard from you in a while. Yeah, I'm fine. 2 days later, I go ahead and I get a text message from her. Can I get a release? Okay. There's no love lost there. I am giving you this as an example so that you understand from an FMO perspective, I don't do free leads. Other than to my new kids, I'll go ahead and I will start to feed you just to go ahead and get your feet wet so that you can write some apps so you can catch your flow on the sales presentation. But I will build a marketing plan with you and teach you how to fish. That's what I do. That's how my guys go ahead and learn how to do this. And all of you that have gone ahead and worked with me when I was with Anthem know that. Because that's what I've been doing from jump. If I teach you how to fish and we use your strengths to go ahead and do it, I'm not the chick that's going to go ahead and say, how many of you guys have sat with somebody, a carrier rep or an FMO, that has gone ahead and say, go to the senior centers, go to Section 8 housing, go here, go there, do retail, do this, do that, right? They don't talk to you to actually figure out what your strengths are. They don't actually look at it and go, Mary kills it with retail all day long and twice on Sunday. She's really, really good at it. But then you've got other people that do doctor's offices. and go ahead and do outreach there because they have the polish and they're able to go ahead and build their network in that capacity. I have other ones that look at it and go, okay, I'm a wallflower. Standing in front of a room like this scares the hell out of me. Please don't tell me that I have to do this to be successful in this business. Do you have to? No. So when you're looking at building your marketing plan, play to your strengths, not your weaknesses. When you're looking at these things and you are trying to figure out, which I am way off on these slides. Where are we? Yeah. When you're going ahead and you're looking at these things, you want to go ahead and, with the marketing, you want to go ahead and figure out a couple of things that matter, that you're good at, that you like to do. I can't tell you how many times where I do a marketing exercise with most of my guys. Lock yourself in a room for 30 minutes without a phone. Get a notebook. Grab one. Kevin has them at the registration table. And what I want you to do is I want you to lock yourself in that room, no interruptions for 30 minutes. And I want you to brainstorm everywhere that you know you can go ahead and talk to somebody that's a senior. And no, you can't stalk them at McDonald's. So these are things like, Amanda, my husband's turning 65 and he's really good buddies with all of the guys that he went to high school with. There you go. Amanda, you know what? My mom runs a doctor's office, a cardiology practice. Okay. I like to do knitting. I like to go ahead and I volunteer mine. I like to volunteer at the Cleveland Museum of Art. All of those things, do that brainstorming activity. Pick 5, start there with your marketing. 5, that's it. Build your main plan off of those 5, and then come back and grab a little bit more, then grab a little bit more, then grab a little bit more. And then eventually, you load this pipeline into a much bigger way. I am at time or over it, so the marketing piece is actually a full 2-hour course, so I'm not going to go there. I will at some point do another one. We may have me do that next year, maybe. So, but those are things that you want to think about when you're looking at marketing plans. When you set your goals, have them be SMART goals, meaning that they're measurable, that you actually, they've got a time limit to them. Write them down. Don't have them be imaginary goals. Put them in writing so that you can commit to them. Because when it's there, then you can actually make that happen. Okay, setting up an agency very, very quickly. When you do that, you've got to look at getting a tax ID number. You've got to look at logos. You've got to look at getting a business checking account. You need to talk to a lawyer or an accountant specifically to figure out whether you want to be an LLC or an S Corp. I do not recommend that you do that this time of year. So if you're looking at doing that, look at doing it in January, not now. It's too much chaos to go ahead and look at doing it right now, but for growth, start it and look at it for January. So here's my first announcement. So I don't know whether or not you guys know this, the boys are really honked off that they couldn't come to this. Amanda, that's not fair. We want to come to your event too. So with that, and I told them, show up in heels, a dress, and a crown, and baby, you can come on all day long. And I said that to several of them. And of course, as you see, they didn't have the balls. Me personally, I would have, but hey. Anyways, so with that, I am going to do a conference about building your business, taking it to the next level, business development. As always, all of my courses are free. That one will be the first week of February. So mark your calendar now. I will give more content and more information on that in the upcoming weeks once I get all of the stuff fine-tuned. But that is coming, and it will be a co-ed one. It will be themed, because a girl loves a good theme, and we'll have some fun. So just stay tuned when it comes to that. Staffing real quick. Many of you are at a point where you need to pick up a staff. The first person that I recommend that you get is an admin. Best money that you will ever spend. They do not need to be licensed. They do not need to be appointed unless you are having them do your dirty work and talking to your clients when it comes to advising on benefits and plans and things like that. But to run drug searches, you don't have to be licensed for that. To go ahead and do your mailers, they don't have to be licensed. To set your appointments, they don't have to be licensed. You can start somebody in at about $15 to $18 an hour, put them in starting at 20 hours a week, doing all the stuff that you can't stand. Seriously. Get them a laptop. They can work at home. Trust the people that you have work for you. If you're hiring somebody that you are afraid, well, how do I know that she's actually working? How do I know that I'm actually paying her and she's not taking advantage of me? Dude, if you've got to go ahead and ask that question as you're hiring somebody, you can't trust them, you got the wrong person. The person that you hire, you should trust, and to be able to know that they are honest, that they're going to go ahead and work for the money that they go ahead and they put up, right? You start them half out at 20 hours a week, and then you notch them in. Anybody that you hire wants to have a career path. They don't want a temp job. So as you grow, they grow. And you need to look at it in that respect. Otherwise, what's going to happen is you're going to have a bunch of turnover, and nobody wants turnover, right? When you're looking at picking up an admin, you want to go ahead and get them in. Candidly, right now, you've got until August 1 to get them in, or otherwise forget it for AEP. So start looking, make that happen. If you can't hit that 8/1 date, look at it after January. Because the last thing you want to do is come 8/1 is learn 2022 products, get set up for AEP and ACA and whatever else that it is that you're running, and train somebody new and double check their work to make sure that it's right. So that's what you want to go ahead and look at. Business needs. Candidly, guys, no lie, I had an agent who sells adult products on the side, and when I asked her for her business email that she was using for her Medicare business, I swear to God, essenceoflove.com. You know, I know that seniors need love, and I know it's a total Frankie and Grace and Frankie moment if you watch that show on Netflix, but come on, right? Treat your business as it's a real business, that it's not a mom and pop. Joanna says this all the time, so do I. You've got to go ahead and if it's not real to you, it's not real to them. And if it's not real to you, you're wasting your damn time, find another career. And yes, I did say that. When you're going ahead and you're looking at this, it costs us, what, $12 to pick up a domain on Google? And then you have a professional domain that you can go ahead and, like mine, Amanda@MedicareAnswersNow.com. You want to have that so that you have the professional appearance with it, okay? Look at that. How many of you guys have business cards, actual paper business cards? Thank God. Now here's the next tool with that. Put your picture on them and make sure that the phone number is at least a 12-point font. Old people can't see. We know this, right? And my mother's shaking her head going, yeah, I need my readers. So did Scott. So those are things that you want to go ahead and be aware. If you are working in a senior environment, you have to be able to relate to them. So if you're giving them a business card that has a 6-point font that they can't read your phone number, does that really show that you understand their needs? No. So those are the things that you want. Internally, you want to go ahead and look at getting a website. Ken French does a great job. He does mine. CRM tools, look at Agency Block. It's a really good one. Eric Fierro has another one that is really good as well. Some of your uplines also have a built-in CRM that allows you to track your prospects as well as your sales and everything else. So take a look at it. goal setting, we just said. The last piece on this one, guys, stop comparing yourself. Think of a racehorse with the blinders on. It's your goal. You set it. Whatever that is, it's for you. Don't compare to somebody else because you don't know what they've got and what's lined up there. You don't know, and you sure as hell can't do it when you're comparing markets. That person may have a service area reduction, and there may be 10,000 people all losing coverage, which is why they're able to write mad amounts of business, and you may only have 2 plans that are available because you live in the sticks where there's nothing offered to you. You cannot do that. What ends up happening is it messes with your mind. And because of that, then it psychs you out. And then you start questioning, and then you go, okay. And then that spiral happens, right? So that's where you really want to be careful. Put your blinders on, focus on your goals, only your goals, work with your team to get you to that finish line, and then you'll be able to make that happen. Okay, there's my contact information. You have it in there. I am done. Thank you for listening to me. Next up is Ms. Joanna Wyckoff. So she is going to come up and talk about Social Security.
Can I just set these down here?
Yeah.
In case I start choking.
Oh.
Thank you. Well, hello, ladies. This is my first ever stage by myself, so I'm a little nervous. Normally I have a couple people by me. My name is Joanna Wyckoff. Some of you guys know me from social media. I have Medicare Mentors and the Insurance Ladies Facebook group, where I like to socialize with a lot of you guys. I know almost half the room there. My topic today is Social Security for agents. I'm going to give you some background about myself. I grew up in upstate New York. I was a poor kid. I got free lunch, but I went to private school because my dad worked hard. And I went to college. Third year in college, I was working full time, and in college, and I got a D in chemistry. And I said, well, I guess they're not going to let me into med school now. So I had to go find a different job. And I saw a commercial for the Navy on TV, and I said, well, I can go do that. It was a combat photographer, and I was working for the photo lab at Walmart, so I can go do that. And so I walked into the Navy's office, and they said, that's so nice, honey. Let's go next door to the Air Force. And they walked me next door to the Air Force, and the Air Force was like, great, you can do whatever job you want. What do you want to do? And I was basically like, I just want to get the heck out of here. You know? And I did no research at all. And I ended up going open electronics into the Air Force. And I had no idea. This is before the internet. This is 2003, before Facebook and everything. I had no idea how to research what jobs I should do and anything I was good at. And so my recruiter's like, you're going to be great at it. We know recruiters. And so I get to basic training. And the 4th weekend, they're like, you are going to be an F-16 avionics person. And I looked at the person next to me. I said, what's an F-16? I had no idea. I had no idea what I got myself into. And you guys see me, I'm 5'4". 5'5" on a good day. My driver's license says 5'5". F-16s are big fighter jets. And the parts weigh a lot, usually about 100 pounds for a good thing. So that's a lot for a tiny little girl to be lifting all day. Anyways, I traveled the world, Germany, Idaho. I got injured in Germany. A pressurized air hose flew off the jet I was working on and hit me in my chest. I should have died. It was a couple thousand PSI. I didn't die. I got back up, and dusted myself off, and cursed out the person who didn't connect it right. And I started getting massive chest pains a couple days later. And you know, they do all these tests, and they say, nothing's wrong with you, go back to work, right? Well, you feel it like, doc, it hurts, you know? So I made a deal with my guys. I said, all right, you do the lifting, I'll do the screws, and I'll do the paperwork. That got me by another year. I transferred to Idaho, and I had orders to Florida, and they said, not so fast. You've been on a no-lifting waiver for a year, you can't stay. we're putting you on a temporary medical retirement. And I said, okay. And they're like, you have to leave in 10 days. And I was like, where am I going to go in 10 days? Like, I was expecting a 20-year career here, you know? And I was newly married to a French guy. And I said, well, where are we going to go? He goes, I have family in Atlanta, Georgia. I said, we're going to Atlanta, Georgia. And so I ended up in Atlanta, Georgia, and I thought, this is great. I'm going to be a civilian. I'm going to find a desk job. I finally out of the sleet and snow. I was tired of working midnight shifts and everything. And I thought everybody would be willing to hire a veteran. Nobody was. They said, what is a jet mechanic going to do in my office? And I said, I have some computer skills, I have some phone skills, but nobody saw it. It was 6 months later when I told my husband, I said, if I don't find a job by Christmas, the money I borrowed from USA is going to be gone, and we're not going to have money to pay the electric bill. And another veteran saw my resume on Craigslist. I'm forever grateful. Steve Austin from Loris Tech hired me the day I went in for a 1099, $12 an hour job, but I was so grateful for that opportunity. I stayed there for 2 years, climbed up to, I made about $40,000 when I left as the registrar of that school. And he let me go to school full time after work, so I went to work and then I would go to school from 5 to 9 every night. And you know, everything happens for a reason. I was dating this guy, and the relationship was not so great, but his mom worked at Social Security. And she was always like, Jojo, give me your resume. They're hiring disabled veterans. And I was like, Mom, what am I going to do with Social Security? I don't want to do Social Security cards all day. And, like, I didn't know what they did. It just didn't seem like a fun job, right? And she's like, just give me your resume. So I gave her my resume, and a year later they called me. And about 4 months later, they hired me as a contact representative. And when I got to that job, the whole lobby, like, it was just you sitting at your window and a whole lobby staring at you. And they're just waiting for you to call their number. And they were like watching everything you did. Anyways, it was really nerve-wracking, you know, and I had to learn, like, you all know after doing Medicare that there's so many different pieces to Social Security and Medicare and the government. I had no idea, but they expected us to learn it all and memorize it all. So if you walk up and ask a question, we can just repeat it. I ended up climbing my way there. I found a passion for helping people, especially the people who could not advocate on their own behalf. People who came in with less than 5th grade reading level saying, I don't understand what this is. I don't know where my check is. You know, somebody's financially abusing me. So I started as a contact representative. I worked my way up to GS11, became a Social Security SSI claims specialist. And I would take claims for both parties, and I saw people at the worst time of their life. I saw people on their deathbed. You know, it was heartbreaking. And I was like, you know what? I was meant to be right here to help these people, because some of them had nobody, right? And I stayed there for 9.5 years. I ended up leaving the government because they didn't want to give me any more sick leave. But I had gotten licensed in 2016. A company came up to me in my inbox, you know those recruiters in your DMs, right? And they said, well, how would you like to earn a couple $1,000s on a Saturday? I said, sign me up. And so I'm thankful that somebody got me licensed. In 2017, a lady at one of the meetings says, you should do Medicare. You know a lot about the Part A and the Part B and how to do all that. I didn't even know Medicare sales was a thing. I was like, I can sell for Humana? You know, and she was like, yeah. So that's how I got started. So my first AAP, 2017, I made the mistake of not doing what Amanda said. You don't know what you don't know. I contracted under the IMO, had no idea who they were, what they were going to do, and they didn't do anything. You know, there was no training there, no weekly calls, nothing like Amanda provides, right? And so I struggled, and I would ask questions as I found people on Facebook, and this is the beginning of the Facebook groups. And I would ask Malia Rogers a question, and Becky Jennings a question, and Joe Tertola a question, and people were kind enough to answer those questions I sprinkled amongst them. You know, I tried not to overwhelm everybody. And that's why I freely give advice in my groups today, because if it wasn't for people willing to help me at my lowest, I wouldn't be here. I wouldn't have a career to walk away from Social Security for. So for that, I'm very grateful. For everybody who's ever answered one of my sales questions, I'm forever grateful, because it's the community that's built me. I wouldn't be here today if it wasn't the community who helped me through. When I needed to ask, how do I do a sales presentation? I had no idea, right? And so today, I'm partnered with a great agency. Nation Care decided to take me under their wings, and I mentor about 350 agents today, daily. Thank you. And some of them are here today. I'm grateful that some of my ladies flew in today to see me and drove long ways to see me and support me here today, because that's what it's all about, right? So today my topic is, I have a couple different things I wanted to discuss, but I hope after you guys leave here today that you know the difference between a couple programs and how to decipher what someone has. Because oftentimes people will tell you things and you're trying to decipher, what are they talking about? Why doesn't this person have this, right? So Social Security has two programs, SSDI and SSI, or Retirement and Social Security Disability. And we're going to decipher how to figure out what they have without losing your mind. I'm sorry? Yes, you will get my slides. So this question was posted last week. And Ms. Lisa said she had a 61-year-old woman call in and ask if she was eligible for a dual plan. And she stated that she had Medicaid, but not Medicare, but she was receiving SSDI. And she claimed that she had been receiving it since 2015, so a good 16 years, right? At $1 a month until about a year ago when she got $400 a month. And the agent checked the United Healthcare Producer Help Desk and was told that the Medicaid was active, but there was no Medicare. And she says that she has an insured husband who's 64 on SSI with VA benefits but no Medicaid. And she said, well, what do I do, right? And so if we break this down, you're like, what the heck? How do you have SSDI with no Medicare? How does that work, right? And how has she been on disability for 15 years? And so there's two programs, as I said, Retirement Survivors Disability Insurance versus Supplemental Security Income. That's what it truly stands for. A lot of people use the term incorrectly. They say SSI. SSI is essentially a welfare program. RSDI, SSDI is what we work and pay into. And so Title II of the Social Security Act, that's RSDI, SSDI. And this is based off of the taxes that you pay into when you worked, or if you're a disabled adult child who has a parent who's receiving retirement and disability. I have a 23-year-old disabled adult child sister. She's been disabled her entire life. At age 18, we filed for disability on my dad's retirement record. And it took her a couple years. She was approved. And she gets a check on my dad's retirement record. You know, his check is not a lot, so she gets 50% of what he would get. It doesn't affect his own. And then on the different side, because it's low income, she gets another check for SSI. So she can get a check on my dad's record even though she never had a work record. Or if somebody's a disabled widow and they became disabled within 7 years of their death. You cannot get disability on a spouse's record except ESRD Medicare. These checks come on a third or a Wednesday. So my question to everybody, if you're ever in my Facebook group, is what day do they get their check? If you tell me what day they get their check, I can tell you what they're entitled to, right? SSI, it's a federal income max of $794 today. If someone's a single person, their check is about $794. It comes with full Medicaid. This is for people who have disabled children, autism, cerebral palsy, even ADHD qualifies. Or a disabled uninsured adult, maybe someone is 23 and got hit in a motorcycle accident and their parent is too young for them to have been disabled before age 22, or maybe they didn't have enough credits, or SSI has another program for age 65 I'm going to cover after. These checks come on the first of the month. So if someone says they get their check on the first of the month, you know that they have SSI and full Medicaid in the state that Social Security thinks they live in. So this person on the first slide, she was 61, she became disabled at 45. She didn't work, she was a stay-at-home mom. And she received $1 a month on Medicaid, no Medicare. Her spouse was insured at 64 and draws a Social Security check. What do you think she receives? Any guesses? She receives SSI. $1 a month, $1 a month on SSI, because SSI counts your spouse's income and your income. $1 a month, it gets you full Medicaid. And even if they're working, if they get $1 a month, that Medicaid means the world to them, especially if they're sick, right? So, can she get on her husband's record? Eventually. At age 65 is her Medicare age. She can file for retirement, early retirement, at age 62 on his record. So she has another year to go, and they're actually going to mandate this. You can't draw SSI as a welfare and not take the other benefit. So at age 62, she's going to go on her husband's record for early retirement, and at age 65, she'll get Medicare on his record. So it's a little too early for him. So this age of Miss Lisa, she, age 64, the husband is 64. She should be prepping the husband for turning 65, and then the wife next, right? And so the questions asked, like I said, you ask what day do you get your check? The easiest question. If they say they get their check on a Wednesday or 3rd, they likely have Title II, whether it's a DAC, a SSDI, or widow's benefits. If it's a 1st, SSI. Do you have any questions? Yes. Yes. So I'll use my little sister as an example.
Please repeat question.
She said the question was, she has clients who get both. And how does that work? So for SSI, if your income is under $794 a month, you can get SSI. So Sarah, my disabled adult sister, her check in my dad's record is $500. That's not enough to live on, right? So she can get $314. So the federal max with both checks combined is $814 federally. Some states give a state supplement. So Sarah gets $500 on the 3rd and $314 on the 1st. Now the $314 counts all income. So if Sarah goes and works, that check is going to start going down. They count half her income after the first $65. So yes, lower income people should get 2 checks if their check is under $814, unless they have a spouse or assets. So if they have a spouse that's working, they're likely not going to get the SSI. Or if they have 2 motorcycles, or they live in a house and their mom has them on their bank account that has money in the bank. That's how people, Miss Julie's here and she works with people who have disability and she helps them file. And some people end up messing up some entitlements because somebody thought they were planning ahead and put their kid on their house or the kid on the bank account, and now the asset's being counted, right? It's unfortunate. Yes. If they file for both, $814 is the federal maximum with both combined. As long as they're paying rent, they have to pay where they live. If they're paying less, if they're not paying where they live, the SSI is lower. There's a lot of things that go into it, but if you know 1st, 3rd, and Wednesday, yes, ma'am. If you know 1st, 3rd, and Wednesday, that starts okay, this is what you probably have. I get asked probably 5 times a week in Medicare Mentors, this lady says she's been disabled for 10 years. Why doesn't she have Medicare, right? It's probably because she has SSI. If their parent has, so if someone, let's say you have somebody who's Down syndrome, right? and they're getting SSI as a child. At age 18, they can stay on SSI, or they do a new disability decision. If their parent is receiving retirement or disability, they can transition to their parent's record. But if their parent is too young, so a lot of times an 18-year-old, their parent might only be 40, right? So they might have to wait until their parent is 62. My dad had my sister at 45, so it was, you know. They stay on SSI until they have an aged parent. So I don't know if anybody here is 62 or older, but when you file for retirement, one of the questions is, do you have an adult disabled child? That's one of the retirement questions, because they're looking to find missing entitlements or possible entitlements. And I found them, you know, being an SSI specialist, you know, when parents come in together, I'd be like, wait a minute, your mom gets a check and she's 68 and, you know, you're now 45, you can go onto your mom's record, you know. So takes a long time, but sometimes it happens. Unless they have their own work credit. So if you're disabled, you can still make up to, I don't know, 2021's rule is about $1,300 a month, substantial gainful activity. So my little sister, Sarah, she is now working as a home health care aide, helping a lady eat her breakfast and lunch, and she's making $10 an hour now, right? She's working about 15 hours a week. So Sarah's now accumulating some work credits, right? So my dad's gonna help her file her taxes. She's accumulating some work credits. So eventually, Sarah might be insured on her own record. Yes. Yes. So every year, we had to do SSI reviews. That was one of my lovely jobs. I had to say, hey, I need your paycheck stubs, I need your rental agreement, and the SSI agent would review every year their work entitlements. It's part of the yearly review. So if someone had, you know, not responded, then their SSI check gets suspended until they come in and respond. Yeah. Yes. Mm-hmm. Mm-hmm. So they're just turning 21 or 18, whatever it is. And unless they had that diagnosis since they were 16, they really can't get disability. Is that correct?
Please repeat question.
So I think what I heard is if the child is 21 now and they're just newly diagnosed, sure. Sometimes it takes years to diagnose something like that, right? So if you become disabled under the age of 22, you can be on your parents' record if they are already receiving benefits. Or when they do start receiving benefits. So if I became disabled at 21, and my parent is only 45, when they turn 62 and start drawing a check, I can move over to their record if I don't already become insured on my own. SSI. Yes. So no, I'm sorry, I'm confusing you. All right, so SSDI, that's what we work and pay into. Those are the taxes that come out of our paycheck. SSI, if I can go back. It's not going back. Uh-oh, went too far. SSI, you can be a disabled child and your parents' income is under their income and resource cutoff. You can be a disabled uninsured adult, which happens a lot, you know. Or you can be underinsured, when that means that you're insured for a regular disability, but it's only $500, $600, $700. Well, you can get the extra little bit on SSI.
What does it mean to be on your parents' record, and how does that change the benefits?
Disabled adult child, so my little Sarah. Sarah was disabled throughout her entire life. She has a mental disorder. And so when she turned 18, my dad was 62. So they filed for disability on my dad's record as a disabled adult child, meaning that Sarah didn't have to have the 6 credits on her own record because she was already disabled under the age of 22. It's one of the federal laws. So it's to protect people who, some kids are always going to be disabled their entire life. You know, you're thinking about the kids with Down syndrome, cerebral palsy. They can never get their own work credits unless they're in a job program with a job coach, right? Yes. Yes, ma'am. Your work credits. So there's a whole formula, and I'm not going to go into that today, but I can email it out. Age 22 and under, you only need 6 credits. So I have another disabled sister. We had a lot of disability. My little sister was in college, and she had worked all through high school. Hard worker. This girl worked probably 50 hours a week in high school and before she went to college. And she came down with a neurological disorder, taking her exams. And when we finally got her approved for disability, she already had her work credits. She already had 6 work credits minimum. And so she has her own SSDI check because she had already started working. And so if they say 22 and under, 6 credits, and then under 30, it's a formula. You have to have half as many credits after you turn 23. So it's like if you're 29, then you only need like, I don't know, I think it's like 15 work credits. I'll email the formula out, but they have a whole formula. So if you become disabled at age 50, say, you have to have 20 credits in the previous 10 years. So if someone stopped working and then became disabled many more years later, they might not have insurability for SSDI. That make sense? And I'll email out the formulas and everything. Thank you. So common boo-boos. Common boo-boos. Another common question in social media is Part B, IEP, and SEP. Ms. Kelly asks, please help. I have a client who turned 65 in August, but she was covered under an employer plan. He left employment and lost coverage 10/31 and applied for Part B in November sometime. Social Security is telling him that he's not covered for Part B until February 2021 since he was in his initial enrollment period. Doesn't the member have a special enrollment period after losing employer coverage? So what happened to this person was, on the IEP chart, which I have coming up next, if you wait until the 3rd month after your birthday, Part B doesn't start until another 3 months after, right? And so this agent was confused by this. And she thought that because the person had employer group coverage, that they could start the coverage any time in IEP. And that's not the case. So somebody has to be outside of their IEP for that group SEP to be effective. So when you're counting on I use my fingers, August, September, October, November, plus 3 months, right? And so this person turned 65 in August. Their IEP didn't end until November. But the November coverage started in February effective. That was correct. Now, this person has a SEP. They could have filed an SEP December 1st for their SEP to be effective. But you can't start the SEP in the middle of an IEP. That's a common agent problem where they're forgetting to plus the 3 months. Yes. That would just start it, yes. That would start it a month early. That's exactly right. But this person, they filed in November. What I would have to withdraw the November application to do what you're doing. But then the person is still without coverage for a couple months because of the agent error, right? But this is why we carry E&O. But you want to be aware of this chart. And again, I'll send out my slideshow. I keep this chart up on my desk when someone tells me that they're still working. If they're going to retire in the first 6 months, I say you might as well take your coverage in your IEP. We'll just time it out exactly right. And so this is changing. In 2023, I don't know if you guys are aware of that, the Benny's Act has already been approved. They're going to make it simpler because it was so problematic, right? And so thankfully next year, they're going to change that where it's going to be effective the following month. Take out all the guesswork because it's just too confusing, right? Plus 2 months, plus 3, plus 3. And so next year, the Benny's Act is going to change it all. So one of the solutions I always give for people who find themselves in a gap on a mistake is a Peterson's Bridge plan. It's a great plan. It's my only solution because they can't get ACA with a subsidy with Part A, right? And so the bridge plan is a little pricey, but with Part A, they get 60% off what the covers for Part B. My last tidbit before Amanda kicks me off stage. Amanda, can I have 5 minutes? Okay. How do you get someone extra money? So I see this all the time, and I saw this all the time at Social Security. I saw this a lot in the blue-collar workforce where people had very low retirement checks. If someone's retirement check is less than $814 a month, they can get qualified for a program called SSI Aged as a single person. If their income is under that and their assets. So the assets is under $2,000 in the bank. They don't own more than one house, the house that they live in. And they don't have any other assets like cash value life insurance over the $2,000. So an example I gave here is Miss Mary gets $700 a month on the 3rd. She was a blue-collar worker her entire life, made about $20,000 a year. She owns her own home and has less than $2,000 in the bank. Based on that, she will likely get an additional $114 a month on the 1st, creating $814 between both checks. So this isn't one way you can find more money for your severely low-income seniors. What about couples? Well, if your couple has less than $1,191 combined, even $1, remember, gets them full Medicaid, both of them full Medicaid. So you can qualify for that. Anybody have any questions? I believe it is underwritten to a point, yeah. Yeah, so someone with cancer or something like that, they're not going to qualify. I would have to get you the brochure. Mm-hmm. Yes. Yes, so I can send you the policy. So Social Security has a policy on everything. It's called POMS, P-O-M-S. So if you go to Google and put in P-O-M-S, SSA, and then the topic you're looking for, you're going to find their Bible. It's going to tell you exactly how they view that topic. SSA, POMS, P-O-M-S. That stands for their policy online manual something. Online system, I think it is, yes.
We have a question online. My understanding is Part B is supposed to be effective July 1st. Most of them got it retroactive, effective back when they turned 65. Do you know why this happens? Also, if they have full Medicaid, is the late enrollment penalty paid by the state?
First part is, I heard their Part B was effective for July 1st for the general enrollment period. And then the Part A was retroactive back to when they turned 65?
Right.
Yeah, that's correct. That's correct. So if someone files in general enrollment, their Part A is going to be retroactive, and their Part B will be for July 1st, which means that if you're going to write them MAPD or PDP, it has to be 471. Yes, if they get qualified for a Medicare savings program will pay the late penalty. That's normal. Normally it takes about a month and a half to interface, depending on the state.
And can aged SSI appointments be completed over the phone, or can an online application be completed?
It's a phone application by the local field office. And there's normally, they can take the application the day before someone turns 65. That's when Social Security determines, they say you're 65 even though it's the day before. So the day before their birthday, they can file for SSI Aged, and it's an application done by the local field office. And it's pretty high priority, so they shouldn't wait more than a week or two. So, thank you, Joanna. Thank you.
Great job. So I know that everybody likes her, her topic. It's a great one. Guys, a couple of quick things. One, the Zoom people are having trouble hearing the questions that you're asking. Sasha, I couldn't tell you what you asked her. So when you guys do this, some of you have heard me say this, use your outside voice. Please turn around and ask the questions. We do have a Q&A session at the end of the day, so please write down your questions as we're going through these modules, and then for the last, I think it's half hour, 45 minutes of the day, we will be able to field any questions that we have not gotten to in these modules, or as you're thinking of them during lunch, we'll be able to address at that time and then go from there. Okay, so next up is Erin Fisher, who Erin and I crossed paths many, many moons ago due to health underwriters. National Association for Health Underwriters, how many of you know what that is? Good, a good majority of you, fantastic. For those of you who do not know what that is, National Association for Health Underwriters is our professional organization. So where doctors have the AMA, lawyers have the American Bar Association, we have NAHU or NAHU. What they do is they do lots of things, but one of the big things that they do is that they are the ones that fight for the changes in regard to any kind of legislative stuff that's up on the Hill. They are our speaking voice to be able to get and affect those change, especially when the government is looking for feedback about what's going on. I have been a member for my entire career, which they also have what is referred to as the Medicare Advisory Group, which is a select group of agents who work directly on bi-weekly and monthly calls with CMS and together to work on specific projects and things like that. One of the cool things that when I was on that group, what we were able to do is I actually had the privilege of being able to revise the Medicare New Book. So not something that many people have the ability of saying, and it was a really cool thing. Erin and I ended up going ahead and were in the group at the same time. So without any further delay, Erin, come on up. So for this one, we're going to do a little bit of an interview style question and an answer and all of that. So Erin, welcome. Please tell us where you're from and how you got your start.
So I'm from Stamford, Connecticut, and I got my start 28 years ago. My son was in kindergarten, and I picked this little-known health plan at the time called Oxford Health Plans, and I interviewed with them for a job because it was 10 minutes from where my son went to school. It wasn't because I wanted to be an insurance agent. It was because it was 10 minutes from where he went to school, and my husband was much farther away. So that's how I got my start, and I actually was in their customer service department, and I was there for about just a couple weeks, and all of a sudden, there's an announcement. Would anybody like to sell Medicare? And of course, there were only, I think there were like 220 employees at the time. So when they had the meeting, maybe 15 people showed up, and as the person was talking, people started leaving the room because they didn't want to talk to old people. So there were, believe it or not, 3 of us that stayed. So we started their Medicare department, and then I went on from there.
And what are you doing now?
Well, I sold my agency last year, and I am just doing Medicare consulting, so I don't have to be licensed or take all the exams, which is a breather. And I sold my agency after working for several healthcare companies, all in Medicare. And some startup companies, and then started my own company. So I had decided that it was time to, my business got really big, and I didn't want to open up like an office, have more staff, have people under me. So I decided it was just time to sell, and I did, and it worked out very well.
So I believe when we were talking, you mentioned something about doing testifying.
Well, through the NAHU Association, being on the Medicare Advisory Group, some of the information actually that you heard today through Joanne, we helped motivate the change, and in particular, the change of this really ridiculous AEP or IEP that Joanna just went over, like you're working, you can't enroll in Medicare for 3 months because you didn't know, and then you don't get it, and it's just really confusing. So through talking to people at the Ways and Means Committee, which is the most important committee at the House, they're the ones that actually have the purse strings, and if you get something by them, you can get it, pretty well passed. But it only took about 4 years to get it done. But we're the ones that brought it to their attention because, believe it or not, the people on the Hill don't know everything. So if they don't know that this is going on and they're saying, oh, that's really bad, and then we brought in not people, but testimony from people that how this affected them. They didn't have insurance for 3 months or longer. So it really hit home to a lot of congressmen, so we got to change. We're also very active in the observation status change, and we're very hopeful that's going to be changed this year. We've had it on the agenda and almost passed last year, but because of COVID, it didn't. So we're very hopeful that that's going to happen this year. And also having COBRA as credible coverage, we're pretty sure we can get that passed too. And also the surprise billing really affects us with the observation status. So that not only goes on in Medicare, but also in the under 65 groups. So we're pretty hopeful about all this. So we'll know, in a couple of months if it's going to all come to fruition. But these are all the things that NAHU does. Yes, it's a membership. It's an annual one. They have 2 big conferences. They have one in Washington every year, if we can have it. And they have also a national one that they have at the end of June every year. So it's a place much like this, where you get to network with people, you learn a lot about what's going on in the country because everything's not the same in Ohio as it might be in Nevada. So these people, they're just very knowledgeable, the people that you meet, especially the Medicare group. And we usually have our own little sit-downs for Medicare. Last session we had, or last conference, we had about, I think, 8 breakout sessions. So you do learn a lot of good things, and you get to network with people in person. And, the last couple of years it's been virtual.
Awesome. Anybody have any questions in regard to NAHU or any of the upcoming legislation, any feedback that you want to give? What is the annual membership?
Yeah, I think it's about $485 now.
Mm-hmm.
Yeah.
Go to nahu.org, so National Association Health Underwriters, nahu.org, and then you can click on where it says membership, and then you'll see the state and local chapters that are in your state. And there are all of the states represented. Hold on a minute. Kathy Herco?
So I have a question. There's the AHIP test, and then there's the test, I believe, now under NAHU. But we're told that not all carriers are accepting.
Mm-hmm.
So is that going to change?
Mm-hmm.
Yes, that is going to change. So what happened, the 2 top carriers, who are very nice, haven't committed yet, but we do love them.
the tap dancing there. That was a good one.
So one of them was recently purchased, so that entered into the fray of they couldn't do everything at once, so we're hopeful for them for next year. And then the other one, we're still talking to them. It's just, it's not as easy as you think to change from AHIP to something else. So they have a lot of computer systems that they have to go through. They have to go through legal, just everything you can imagine. So it just takes time. And we have been working on it for at least 3 years to, notify them that we're doing this, and then we had to give them the test to see if they liked it. And there's nothing wrong with the test. They all like the test. And actually, the test is much more informative. I mean, even, we tell people, even if you're not going to sell Medicare and you have to know about it, like a lot of financial advisors want to know about it, it's much more informative than AHIP. So, if you know anybody in those other professions that need that, it's worth it for them to do it.
Have any of you guys taken the exam? Taken the NAHU exam?
No, because the two people that, companies
but
aren't doing it.
You have people from multiple states, and they don't all sell all those two carriers.
That's true. Mm-hmm.
So I had the privilege of taking both this year. Yes, I am insane. We all know this. Come on. So I did take both. I did the beta testing for Anthem through the NAHU, took the course and everything else, and then of course everybody takes AHIP just so that way it fulfills that metric.
Right.
I will be the very first one to say that, and I supplied the information to Farron, who works in the training and development for NAHU and everything else. The NAHU certification, guys, is fantastic. Yes, it's an extra training. Yes, it's going to be an extra couple of hours, but here is my suggestion. The information that is contained in that, I think it's $100, $125. But there's 2 reasons why I would suggest taking it. I know it's adding more to your plate. There are resources within that certification that are really, really good. You are able to download those slides to be able to go ahead and look at them. They are searchable, shocker. And the way that they wrote this is they wrote it from the perspective of the agent, and it gives you more real-life application than reading the stereo instructions that you get and the boringness of the AHIP. So I promise you it is well worth it, but then even still, when you take your exam and you pass, there is a graphic that you get that allows you to say that you are Medicare certified. And I know some of you are going, oh, you can't say that, but you can. You can say it because it is a designation that the professional organization is allowing you to go ahead and use. And it is an annual one. Just for the marketing alone with that seal, in a heartbeat, I'm spending that money. And y'all know how busy I am because I kind of am like running around like a chicken with my head cut off, just like you. It's well worth it to do that. So take a look at it. Even if you are, if you're not a member, you can take it. It does allow you to have CEs. So several of you are going, but you wait for the last minute on your CEs. That's another 8 CEs for some of you looking for those. So yeah, seriously guys, check it out. I will be next year, if they get both of those carriers, hands down, you will hear me get even louder than I am now about it to say that's your default that you should be using next year. It is that good of a course.
Another bonus that's coming with taking the course for free is that every month we're going to have an in-depth look at a Medicare benefit or a regulation. So it's going to be free for the people that take the certification, and other people are welcome to pay for it if they want to do it monthly or on an annual basis. But that's going to be well worth it too. Things that, just like what Joanna's talking about with Social Security, maybe we'll have her, because there's some benefits that, believe me, are bizarre. And I'm sure some of you know about some of them, but we can't know everything. So it's all about education, and that's really what NAHU wants to do for their members, besides the fact that we really want to advance really good regulations for Medicare and the under 65 crowd too, with Congress.
Right there. He's got a mic behind you. Go ahead and talk into the mic. Other side. There you go.
Do you know if NAHU is looking into the Stop the Wait Act for the 5-month wait period for disability beneficiaries? It would give them access to Medicare sooner.
No, I don't know that. It may not be under our purview. We might have to go to Social Security for that. But if you want to tell me about it, which is another thing that we ask all the agents, like especially in the Medicare advisory, we're asking all of our agents all the time, like, what's going on? You know, what do you want to see changed, so that you can tell us. Now, it's, you know, people think that you can have it changed overnight. You know, like I said, it takes like 4 or 5 years to get things changed. But would you tell me about that afterwards, and I'll see what I can find out for you.
Other questions? Hold on a minute. He's running with the mic. Hold on. Let's see how fast Nate runs.
Oh, that's you pay extra.
Okay. I'm fairly new to this, but I'm finding that I have clients who signed up late for Medicare because they're healthy, never had a drug, but now they have a penalty for the drug plan. And then also finding some older people who had original Medicare for so long, for whatever the reason, you know, community saying don't sign up for those Advantage plans. And now they're signing up for the Advantage plan, so now they have a penalty. Does NAHU, are you guys, do you have that on your agenda to sort of help people out or get rid of this, or especially people who are paying under $10 a month? I have somebody who's paying $2 or something. It just seems ridiculous.
Well, these are all federal regulations, and yes, we do bring them up from time to time when we can. And some administrations are anxious to see some changes and others aren't. I wouldn't say that those two things are high on their agenda to change, though, because they are making money from them. Mm-hmm. And I agree with you, it's terrible. I'll just give you like one short example that I had once where a woman, it may not apply, but this is something, if you don't know, you can do it. She was given a penalty, and she wasn't supposed to have one, which I won't go into, but she wasn't supposed to have one. So I said to her, this is what you can do. You can call your congressman, doesn't matter what party they're with, just call the one that's up for re-election, tell them what your problem is. Really? Tell them what your problem is. There's somebody in every congressman's office that deals with Medicare and Social Security. So you just, you know, have to be very polite, call them, find out what's going on. I've been on the phone and have done it for my clients because there's, for sure, no, they're not gonna listen to me. I'm never gonna get it changed. So yes, she got it changed because it was wrong what happened to her and she could prove it. So even though she didn't have it in writing, nothing was in writing, but the congressman went to bat for her. Now, all congressmen may not do that, but so call the next one. Or then call the senators. Senators are last because they're up every 6 years. So this turned out to be a NAHU commercial, really.
It kind of did.
Not bad. I mean, I'm all for it. And I think, you know, you should really look into it. We also have on Fridays from Jessica, we get an overview of what happened during the week legislatively and just other news things and resources. It's really fabulous. And when you see it, I used to see it on Friday, this, you know, happened, and it's like, oh my gosh, it's 5 o'clock already? You know, because like, you just feel like you just got up because you're just working, you know, especially during AEP. But you kind of know it's time for cocktails when you see her newsletter come around on Friday.
Yes, definitely. Other questions?
So I guess nobody's here is selling their business, right? Because it's all
I was going to say, we actually have a couple that are selling your business. Can you talk about that and what was involved? And
so there are a lot of things involved in it, and it's going to take 6 months to a year to get everything straightened out, only because of the carriers. It's the same ugly process of asking for a release. So, but there are a lot of good ways to do it and bad ways. You do need a lawyer. I would not do it without a lawyer, even if the other person doesn't have one. You need a lawyer. And what happened to me, I had a pretty unique business for Medicare, and I sold the name of my company to the person, and I also, in quotes, sold them my bank account, because what happens is the commissions are going to come in after you've already signed your drop-dead date, I sold my business. So he didn't want them to come into my account because he thought I was going to keep them, which of course I wouldn't have. But, you know, I said there was no problem. You know, I said, sure, you can have my bank account. It had the name of the company on it, and all the commissions went to him, and everything worked out fine. But, you know, some people were a little scary about that when I told them that I did that, but it worked out fine. You know, your bank will help you with that. Sometimes if you have a bigger agency, you might want your staff to go with the person that's buying you. And there is a plethora of people that want to buy your Medicare business. It's just amazing.
Mm-hmm.
So
Yes.
if you have any further questions, I'll be here. You can ask me afterwards.
So we are, Jen?
Hey, yeah, I wanted to add on to the Nahu commercial that was going on here. Joining and becoming a member brought a level of expertise and responsibility into my practice that we had never had before. So when my clients come in and they say, why do I still have to pay that Medicare Part B premium if I'm taking Cobra? That's stupid. Instead of saying, yeah, you know what, that sucks, doesn't it? I could say, actually, I just talked to George Lang about that 2 months ago, and it's something that we're working on, and this is the bill. And then when that bill gets passed after 3 years of going in and knocking on doors and meeting with aides, you can say, that's it. I played a part in this. Surprise billing, I sent that shout, or not the Operation Shout, but the newsletter, screenshots to my parents and family, and I said, this is that thing that I have been working on for 5 years so that you don't get a surprise bill for $3,000 from the emergency room. And it all came from my membership with Nahu. And it's not just about politics, and it's not just about the federal level. You get benefits at the state level, where we work with your state government. We're in Columbus every year. You work on the local level as well, so it's not just you writing a check and it goes off to Washington, D.C., and you never see where it happens with your money. But it works on the state level. It works at your city level. I'm Greater Cincinnati president, so I'm personally in charge of trying to get us fun learning experiences so that it's not just politics. It's also professional development. It's also networking, and sometimes it's also happy hour.
Yes. So, okay, so why did we do a quote unquote kind of mock commercial about this and working with Erin to talk about these types of things? The reason why is I can't tell you how many times that I've heard from agents that I talk to and go, I don't understand why this is this way and I don't like it. I don't like that my client has to pay an LEP. I don't like that my client has to wait until general enrollment period for this, that, or the other thing. And I don't like the observation status mess that's going on, right? What do you think my answer is? Because I hold my tongue so well, right? Use your voice. You have a voice, and it's not that it goes unheard. But if you're complaining about something, for the love of God and all things holy, use your voice and do something about it. If you don't like it, work to fix it. Otherwise, you have no leg to stand on. That goes with the carrier, it goes with the underwriters, it goes with legislation, it goes on with your own personal life. Use your voice, the examples. One of the things that Erin said is we are looking for testimonials. We are looking for examples. Because how many of you have gone ahead and brought a problem up to the carrier and the carrier goes, prove it, right? First thing, I don't think that checks went out to my clients, or I don't think ID cards went out, right? We have that problem every January. And you go, ID cards didn't go out. And then come to find out, 20,000 cards in the state of Ohio magically didn't go out for a specific carrier, Things like that happen. But unless you use your voice and you bring examples to the table to affect those changes, we can't move forward. So get involved, do those things, and then that way it happens. So Erin, I thank you for flying out here and spending the time with us. Ladies, please spend time with her. She is a wealth of knowledge, and she's awesome to go ahead and get to know. Are we ready? We are. Okay, so we are at noon. Those of you who signed up for headshots, they are down this hallway and around the corners. Chris is there doing those. You are more than welcome to. We have a full lunch buffet. We will get started again at 1 o'clock. So by all means, please mingle, meet some other people that you have not met, take some pictures, post them everywhere, and please check out my killer cupcake table. It is awesome. Awesome. You guys are going to die when you see what Cindy did for us this year, or for this. I got cupcakes that have crowns. I got cupcakes that get high heels. I got a little bit of everything. So check it out, ladies. Go have lunch. Enjoy.